This is the question we came up with when we were thinking through this, and I love this question because it truly has defined the last 20 years of my career in healthcare. So I've been in this industry for the last 20 years. I've traveled in all 50 states, Europe, and the Middle East, and there's incredible challenges. Many of them are common, though. It is really interesting when you look at healthcare, the commonalities, but when you go out there and you look at the changes or the challenges that you see, there's subtle variations. And this is why we always say healthcare is super local. Throughout my career, my whole job has been to use data to empower new things. So build things, solve problems. In 2009, we called it informatics. In 2012, we called it big data. In 2013, we said machine learning, then came deep learning. In 2018, I think if you had a company that didn't say AI on it, it didn't exist at all. Interestingly enough, in 2013, I led a product team, and what it was all about was creating agents. So we said, we're going to have this field of agents. They're going to power the entirety of the healthcare ecosystem. They're going to go out, and it's going to be an agentic revolution. It's kind of proof that all things old will be new again. So what have we seen over this last 20 years? I've been a part of building hundreds of algorithms. We've done some incredible things. We built them for every major disease organ, every major process, critical processes. It's been kind of incredible watching the math transformation over the years. But only a few of them made it into production. Only a few of these things actually can go impact the care. They actually go achieve the aim that we were setting out to do. And so it's interesting, you sit back and say, why? Why did this not happen? What was the rate limiter to adoption of this innovation? And then what's going to change now that we have great AI at our fingertips? And I argue the biggest thing that has changed is that 6 months is now 6 hours. And so what I mean by that is everything we used to do, it was just always, it would take 6 months to build an algorithm, walk it through the production life cycle, and get it into the hands of our users. This was incredible. Now, with that, I'm kind of balancing these two sides. Am I more joyful or fearful? The joy side of me is like, I love the idea of starting my morning, having a product team with my team, thinking about strategies, and by the end of the day, something is production ready to go out into the clients. That would be incredible. But the stakes are super high. This is a field that doesn't accept sloppy, and if we don't do it right, it will get rejected instantly, almost like an antibody. And so we've got these two balancing factors of what are we going to do and how are we going to succeed in adoption. And historically, the way we did this was through a truly deep understanding of a problem set. We had to go out and connect. We had to go out and talk to people. And this process had these natural rate limiters of time where you'd create an idea, you'd go gather data, you had to interview people, you had to go observe people, you had to read everything. And that 6-month process is where we became experts. We became true experts in what we were doing. We knew more than anyone else about that problem set, and it just became a built-in rate limiter for success. And now, ask a question and hit go. That's the fearful part. Are we actually going to understand a problem? Are we actually going to have a problem that matters, which often you're people solving problems that do not matter? And this is where my fear is rooted. So we have this thing. We talk about a therapeutic effect. And what it is just a simple test to say, are we achieving a therapeutic effect in what we're building for our clients? What are we doing for our clients? So let me just explain this a little bit. I'm going to break it down. This is not AI generated. I've got on one side a person. It's a well-drawn stick figure. It has a hurt knee. You can tell by the cloud and the red dot. And on the other side, I've got a blue and red pill. The blue and red pill have no real scientific purpose. It's just two colors that I liked. I don't know what pill that is. But a therapeutic effect is if that person takes the pill and it gets rid of the ouchie. That is a therapeutic effect. So, getting rid of the ouchie. What you said in another way, did what I build do what I wanted it to? Did I achieve the aim that I set out to achieve? And so this framework of a therapeutic effect, I actually use internally inside the company quite a bit. And what I'm seeing out in the industry are the variances from this framework. And so let me walk you through what the framework is. At the top of the framework, we have the overdose. The overdose is simply the point when you have a medication that has an overreaction or a toxic effect on the process. This is what I see in healthcare with AI all the time. And I'll go into what that is. I'll give you some examples. In the middle is the target. That's the achieved therapeutic effect. This is when we hit our target. We knew our problem, we achieved our aim, and we absolutely solved our issue. This is very hard and it can be super elusive, especially if you're not an expert in your problem. At the bottom side, we have the placebo effect. The placebo effect is fun. Every week I try a new AI, I sign up for a subscription, I see a lot of placebo effects. Things that are out there, they're super cool, they don't change my day. Placebo effect has no effect at all, but sometimes make you feel well. So I'm going to walk through 3 scenarios, and I'm going to do the placebo effect first because this one's a little embarrassing for me, and I hope you forget everything that I was a part of this, other than the fact that there's some good concepts here. So what we were doing, we went out on a pretty ambitious mission. We wanted to map a plane and put every human on 2 axes. How well are they relative to everyone that is exactly like them? And how complex is that patient? Where should they be in the complexity scale? So we went out, we dug in, we had massive amounts of data, we scraped data, we assembled this data set, we read, we debated math all the time. About 6 months in, we felt super cool. We were like, we just solved the biggest problem in healthcare. We're ready to go challenge a physician, man versus machine. And so we did. We went out, we called up a physician and said, we'd like to go run our algorithm against your patient set, and we're going to teach you so much things about your patient that you don't even know. So we did this. We ran it against 1,200 of her patients. And as we entered the meeting, we were waiting for the aha moment. And as we went through, she systematically educated us on how compassionate, professional, and expert that our physicians are in the market. She knew every single patient, every single one of them. Some of the things, she had some interesting factors. She goes, oh, I didn't know that happened. But it would have had no bearing on their care. We licked our wounds, we stepped back and said, where did we go wrong? And it was very obvious. We did not engage the user. We did not find a problem that mattered. We built a hammer without understanding if there was a nail to even exist. And that was our big failure on this one. We ended up shelving it a couple years later. So now it's simply a patent waiting out there to be leveraged at some point. All right, the overdose. This one's super common. This is what I see every day. And here's an example. So in 2012, this would have been in 2010, sepsis was well known about being one of the largest killers inside of a hospital. This simply is a blood infection. It gets in and causes septic shock, and from there is death. Huge problem inside hospitals. And it was really interesting because people said, they took a leap here and said, well, there's a well-known guideline, well understood, called SIRS. So they took the SIRS guideline. And they said, what if we just write this as a rule? Because we have computers now. We can use machines to help every physician and clinician in the hospital see the outcomes of that SIRS rule. And what they did was they plugged it in. They programmed the algorithm inside the hospital. And guess what? That algorithm defines a sick patient. Who is inside a hospital that's been inpatient? Sick people. It alerted every single person in the hospital, the entire ICU, the ER, every patient was getting alert. This is an overdose. This is an absolute rejection. The clinical team said, no, why would we turn this on? And so luckily, I had the privilege of working with a super dedicated team. They went in, they did the hard things. They talked to people, they learned, they spent countless hours, days, nights, weekends, studying the problem and becoming truly experts around how do you truly identify sepsis early before it turns into sepsis shock. So that was the overdose. Finally, therapeutic effect. We did have some, just so everyone is aware. It wasn't complete failure throughout the last 20 years. This was a super exciting project. 2013, CMS, Centers for Medicaid, passed a new law where they were both promoting or rewarding hospitals for achieving lower readmission rates, and then they were going to begin penalizing hospitals that had higher readmission rates. So we set out to solve this problem. We partnered with a hospital system up in Chicago. We dug in and personally interviewed over 100 physicians, sat and watched thousands of hours of nurse navigators, nurses. We became experts. The team read and read and read. We interviewed. We validated the process. We built a beautiful algorithm. We deployed it into the system and instantly achieved a therapeutic effect. We watched readmission rates decline. We then were able to take that algorithm and that process and deploy it widely throughout the healthcare system, and that ended up being a tremendous outcome. We knew exactly the drop in readmission rate if you were going to adopt that program. But what was so great about it? What was the winning feature about this algorithm? The algorithm was same math. It was actually probably easier math than the complexity score. It was the fact that we embedded it and we understood our problem. It was in the clinical workflow, seamlessly. Everyone knew exactly what was going to happen. They didn't have to go anywhere else. They were able to adopt quickly and understandably because it had everything in it. When that way they asked the tier 1 question, the tier 2 question, the tier 3 question, the product was able to serve that up for them. And that was a really interesting product and learning around becoming an expert before you set out and build new AI. Oh, and the pesky side effects. We talked about those a little bit. They come out of nowhere. This one had a side effect, less patient revenue, less volume. So don't worry about those. They happen. Just have to manage them as you go. So this is where I do just truly believe as we sit back and we start engaging with our teams, and we have this incredible technology that we need to be careful. And as you work, you're going to move through your careers, and you just need to become humble and expert. So talk to the experts. That's how step 1. Observe your target. The power of observation is unbelievable. You see things, you're able to ask questions, subtle corrections, by just truly observing the people that you're trying to build something magical for. And then this is one of the contributors of Forbes. I love this article. He talks about becoming an expert, and this is truly what needs to happen. Your expertise, your control of a topic, your domain will set you apart, because then you can truly ask the technology do great things. I always kind of joke on this one. It's like, just think how great Socrates would have been in the Aegeanic era, asking incredible questions of software. So in closing, build something for someone. And this is really important. We in healthcare have a bunch of users. We have all kinds of problems that we're addressing regularly. And the limitations between technology and the human are massive. We can do better. And if we can truly limit the waste and connect patients with their physicians, magic happens. And I believe we'll be able to achieve a therapeutic effect. And if we can actually leverage Gen AI, unlike we've been able to do over the last 20 years, we will be able to bring a little bit of humanity back into the healthcare system. And with that, thank you.